So when you talk about complications of care, guys, this is a type of injury the patient would develop or sustain because of some medical intervention. Okay, this is what we call complications of care, or there is actually a term for that, a medical term for that, which is it is sometimes doctor would refer to that as this term here. When you guys encounter this, okay, iatrogenic, or we call this is complication because of a treatment, a procedure, or medical intervention and whatnot. This is it. Okay, so this is what we're going to talk about, and I think that's the last part of the injury chapter. Pain due to medical devices. Let's read. Pain associated with devices, implants, or grafts left in a surgical site, for example, painful hip prosthesis, is assigned to the appropriate code found in Chapter 19, injury, poisoning, and certain other consequences of external causes. Okay? Now, specific codes for pain due to medical devices are found in the T code section of the ICD-10-CM. Use additional code from category G89 to identify acute or chronic pain due to presence of the device, implant, or graft. Okay, here it is, guys. Okay, when a patient is experiencing a complication, like in this case, guys, is a pain due to a device, how are we going to code it? In the coding guidelines, guys, there are many kinds of pain. Well, in not only in the medical world, there are many types of pain that can be documented, okay? And there are pains that are caused by a definitive diagnosis, like osteoarthritis, or say pain due to a definitive condition, like pain due to cancer. There are many types of pain. But if you're describing a pain that is due to a medical device, like a patient had a hip replacement, and that hip replacement is expected to have already been, like after a few months, it is the expectation is a person would have that surgery completely healed, right? So if a patient's still experiencing some pain, and this pain is rooted from or because of the of that prosthesis, you are now to assign a pain due to medical device, or due to prosthesis. So there is a way to code for that type of complication. It is considered as a complication. Okay. Now, how are we going to look for that code, guys? What we're gonna do, guys, let's say, for instance, I'll give you a scenario. Okay, and the scenario looks like this. Pain due to right hip prosthesis. So patient had hip replacement some months ago, is still experiencing pain. It's not normal because the patient should have fully recovered from that surgery. So how are we going to do that? So let's go grab our book, guys, and we are going to the term pain. Everybody please do that, okay? Pain in our book. Okay, so I'm here on pain. Here, okay. Now, pain due to joint prosthesis, okay? Pain due to, okay, so what you're gonna do, guys, is go to pain in the book, and then go to device, and go to joint prosthesis. And tell me, guys, what code do you see when you go like this? Okay, Jess, you have T8484. Let me write that down. So the code you're going to see is T8484. Now check the tabular and see what your complete code is. Okay, so Jess, you have T84XA. Only one X, right? Because, yes, only one X because you already have 5 here, 6, and then your last character is A. That's okay, Jess. Okay, so this is how you assign the code for this type of scenario, guys. Okay, so if the pain is due to any of those types of device or prosthesis, by the way, guys, device is something that is uh, left with the patient even after the procedure. In the coding concept, okay, or in the concept of coding, uh, it is considered a device if that material, non-biological material or biological material is, or that biological material remains with the patient after the procedure. So what are those types of material? That non-biological or biological materials? Graft, okay? If a patient had a procedure with a skin graft, uh, from the patient himself or herself. If the skin is taken from another part of the body and transferred to uh, another part of the patient's body, that's considered as a device. It's a biological device. In this case, a prosthesis is a non-biological device, right? So if the person continues to experience pain because of that, this is how you look for the code. Okay? Any question, guys, from this example that we have here? Yeah? Okay, let's continue our reading here. It says here, okay, injury, poisoning, and certain other consequences of external causes. Okay. That should have been also coded. Now, specific codes for pain due to medical devices are found in the T code section, which we already know. Use additional code from category G89 to identify acute or chronic pain due to presence of the device, implant, or graft. So don't forget your G89 code, guys. If a patient is suffering from an acute pain, post-operative acute pain, then there is a code for that. If you go to G89, I think it's G8918. I'm not so sure, but you guys will have to check that in the tabular. What is your code for acute pain post-operatively? There is also a code for chronic pain. And if I can remember it on top of my head, it is G8929. If a patient continues to experience chronic pain, okay, and that is that chronic pain is coming from the device, like a prosthesis, joint prosthesis, you are also to assign the G8928 or G8929. Okay. Now, what about this transplant complications? Let's read this. Transplant complications other than kidney. Codes under category T86, complications of transplanted organs and tissues are for use for both complications and rejection of the transplanted organs. A transplant complication code is only assigned if the complication affects the function of the transplanted organ. 2 codes are required to fully describe a transplant complication. The appropriate code from category T86 and a secondary code that identifies the complication. Okay, so if there was, some kind of rejection of the organ, okay, and of course, if a patient had a transplant procedure status post or from the past, and for unfortunate reason, the newly transplant organ is being rejected by the host, by the body, then it is considered as a complication. And what is the code that is talked about here in the coding guidelines? It's where it is under the T86 category code. Can we please look into T86 and what does T86 category code exactly is stated here? So I'm gonna go look at T86. I'm already at T84, so it will be easy for me to jump right into the T86. T86 here says complications of transplanted organs and tissue. And there is an additional note saying use additional code to identify other transplant complications such as graft versus host disease, malignancy associated with organ transplant or post-transplant lymphoproliferative disorders. It's kind of like a tongue twister there. Anyway, so the guidelines are telling us that if there was some kind of rejection in that transplanted organ or tissue that is transplanted, assign the T86 code. So the T86 codes, guys, that's your say that is your category code. And if you want to be more specific, the T8600 is about the bone marrow transplant. If a patient had a bone marrow transplant and it's not working, you are to assign a T8601 for bone marrow transplant rejection. And, the other reasons for complications are listed here. There is rejection, there's failure, there's infection. Okay, so you can select the best option here, guys, depending on what was reported in the medical record. If it is a failure of the transplant procedure, right? Failure or rejection, or if it was a malignancy, there is a specific code for each one of those scenarios. Okay. And the follow-up instruction is if there are other complications or any effect of that rejection or failure, you also have to assign the code for those conditions. Okay. Any question, guys, so far? Okay, let's go to the next one. What about, no, not that one, right here. Kidney transplant complications. So patients who have undergone kidney transplant may still have some form of chronic kidney disease. I don't know, guys, if you remember our discussion about this chronic kidney disease on a transplanted kidney. Let's see here. Because the kidney transplant may not fully restore kidney function, code T86-1 should be assigned for documented complications of kidney transplant, such as transplant failure or rejection, or other transplant complication. Code T86-1 should not be assigned for post-kidney transplant patients who have the chronic kidney disease unless transplant complications such as transplant failure or rejection is documented. If documented is unclear as to whether the patient has complication, query the provider. Okay, this is how it works, guys, okay? The guidelines are telling us that if a patient, a transplant kidney patient, still experiencing chronic kidney disease, like stage 3, stage 4 chronic kidney disease, the guidelines said do not assume that it is a complication to the transplanted kidney, okay? Because it was further explained that a CKD is highly possible for a patient who had kidney transplant because that procedure, the transplanted organ may not immediately fully restore the kidney function. So if a patient continues to experience some kind of a, chronic kidney malfunction, it is, sometimes it's but normal for a patient to still have that kind of kidney malfunction, because like what the guidelines are saying, this newly transplanted organ will not work right away. It's, you know, there's some, what do we call, some time to really patient need to wait for a little bit before this newly transplanted kidney will stop working properly or to its best capacity. Okay, so that's what the guidelines are trying to say. Now, the guidelines also mention that do not assign a code for complication of transplanted organ unless, okay, unless you find it or you see it in the documentation that the doctor is saying, hey, a patient's kidney disease is because of the kidney transplant failure or the kidney transplant rejection. Okay, do not assume that the chronic kidney disease is a complication to the transplanted kidney. Right? Is that clear, guys? So this transplant kidney is a little bit tricky, right? Because like what the guideline is saying, it may take some time before the kidney really functions to its best capacity. Okay, any question, guys? Okay, and the code that you are to assign there is T86.1, depending on, again, the type of complication, if this is rejection, failure, or other type, malignancy, then you are to assign the appropriate code, a specific code for that specific scenario. Okay. And let's continue here. Complication codes that include external causes or external cause. As with certain other T codes, some of the complications of care codes have the external cause included in the code. The code includes the nature of the complication as well as the type of procedure that caused the complication. No external cause code indicating the type of procedure is necessary for these codes. Okay. From last week's discussion, guys, we covered complications of drug and chemical related injuries, right? Complications. When you're assigning a code for poisoning or for adverse effect is considered as iatrogenic type of complication. And if you notice, guys, the code starts with letter T, right? So this adverse effect there is, or poisoning type of condition, guys, there are external cause codes that are built into the codes, and those external cause codes are explained by what is the intention. Okay, if it's intentional, accidental, or self-harm, or was this a type of assault that the patient experiences, those are the external cause codes that are built into the code itself. Let me just get a water real quick. Okay, so in that kind of scenario, the guideline said you don't need a separate code for external cause of morbidity.